we're going to do a palpation route for the knee, starting with the tibia, follow it up, come to a tibial tuberosity, then we have the tibial plateau, then we have the patella tendon, come across to the head of the fibula, follow that down, we have the Peroneus longus, the Peroneus brevis, this comes down, we also have the Peroneus tertius, that comes just there. Come back up, medial and lateral meniscus, we have the inferior polar patella, the superior polar patella, the patella. We have the epicondyles at the side here. Underneath, at the bottom, we've got the condyles of the femur. We've got the medial collateral ligament, the lateral collateral ligament inside there that crosses over with the anterior and posterior cruciate ligaments. On the top here, we've got the quadricep tendon. This goes to the rectus femoris. Underneath that, we have the vastus intermedius. To the side, we've got the vastus medialis. On the other side, laterally, we've got the vastus lateralis. So palpate there. We also have here, we've got the pes anserine, which is 3 muscle groups. So we've got the gracilis coming up. We've got the semitendinosus behind, palpate there. And we've also got the sartorius, so palpating across, going all the way up there towards the hip. And then behind, we've got the bicep femoris, large muscle group for the hamstrings. And then next to that, finally, we have the semimembranosus. And that concludes the palpation route for the knee.